Question 1. The audit findings indicate that a patient presented with significant eye pain, photophobia, blurred vision, and a sensation of a foreign body. The technologist performed a basic visual acuity test and recorded the patient's subjective complaints, but did not perform a slit lamp examination or obtain a corneal scraping for culture. Which of the following actions, if taken by the technologist, best aligns with the regulatory framework and guidelines for a certified ophthalmic medical technologist, COMT, in this scenario? Option A. Recommend that the patient use artificial tears and avoid touching their eye until their scheduled appointment. Option B. Advise the patient to purchase over-the-counter antibiotic eye drops and schedule a follow-up appointment in 1 week. Option C. Document only the patient's reported symptoms and inform the patient that the ophthalmologist will review the information later. Option D. Proceed with a comprehensive slit lamp examination to assess for corneal infiltrates, epithelial defects, and anterior chamber reaction, and document all findings meticulously for the ophthalmologist's review. Correct answer is D. Proceed with a comprehensive slit lamp examination to assess for corneal infiltrates, epithelial defects, and anterior chamber reaction, and document all findings meticulously for the ophthalmologist's review. Explanation. The audit findings indicate a potential deviation from established protocols in managing a patient presenting with symptoms suggestive of keratitis. This scenario is professionally challenging because accurate and timely diagnosis and management of keratitis are critical to preventing vision loss. The COMT role involves meticulous data collection and adherence to established clinical pathways, ensuring patient safety and regulatory compliance. Mismanagement can lead to severe consequences for the patient and professional repercussions for the technologist. The correct approach involves a systematic assessment of the patient's symptoms, a thorough ocular examination, and appropriate diagnostic testing, all documented meticulously. This aligns with the COMT scope of practice as defined by professional standards and regulatory guidelines, which emphasize accurate data gathering to support physician diagnosis and treatment. Specifically, the COMT must ensure that all findings are recorded in a manner that facilitates the physician's decision-making process, adhering to the principles of patient care and documentation accuracy. This systematic approach ensures that all relevant information is available for diagnosis and treatment planning, minimizing the risk of error and upholding the standard of care. An incorrect approach would be to make a presumptive diagnosis and recommend specific over-the-counter treatments without physician consultation. This oversteps the COMT scope of practice, which is to assist the ophthalmologist, not to diagnose or prescribe. It also bypasses the critical step of physician evaluation, which is essential for determining the specific type of keratitis, bacterial, viral, fungal, and the appropriate, often prescription-based, treatment. This failure to involve the physician directly risks inappropriate treatment, delayed diagnosis, and potential harm to the patient, violating ethical obligations and regulatory expectations for allied health professionals. Another incorrect approach would be to document only a subset of the patient's symptoms, omitting those that might be less common but still indicative of a specific type of keratitis. This incomplete documentation hinders the physician's ability to form a comprehensive diagnostic picture. Accurate and complete record keeping is a fundamental regulatory requirement and an ethical imperative, ensuring continuity of care and accountability. Failing to document all relevant findings can lead to misdiagnosis or delayed treatment, directly impacting patient outcomes and potentially leading to regulatory scrutiny. A third incorrect approach would be to rely solely on the patient's self-reported history without performing a comprehensive ocular examination. While patient history is important, it is not a substitute for objective clinical findings. The COMT expertise lies in performing detailed examinations that can reveal subtle signs of keratitis not apparent to the patient. Neglecting this crucial step means vital diagnostic information is missed, compromising the accuracy of the physician's assessment and the subsequent treatment plan. This failure to perform the full scope of examination duties is a direct contravention of professional standards and regulatory mandates. The professional decision-making process in such situations should involve a clear understanding of the COMT-defined scope of practice, a commitment to thorough and accurate patient assessment and documentation, and a proactive approach to collaborating with the supervising ophthalmologist. When faced with symptoms suggestive of a serious condition like keratitis, The technologist must prioritize gathering all necessary objective data, meticulously documenting it, and ensuring it is promptly communicated to the physician for diagnosis and treatment. This systematic, data-driven, and collaborative approach is the cornerstone of safe and effective ophthalmic medical technology practice. Question 2. Benchmark analysis indicates that a certified ophthalmic medical technologist, COMT, is evaluating a patient presenting with chronic ocular discomfort and a sensation of dryness. During a detailed examination of the eyelids, the technologist observes mild erythema along the eyelid margins, telangiectasias, and inspissated secretions at the orifices of the meibomian glands. Which of the following approaches best reflects the COMT role in documenting these findings for subsequent diagnostic and therapeutic decisions by the ophthalmologist? Option A. Document the presence of mild erythema, telangiectasias, and inspissated secretions at the meibomian gland orifices, noting their location and severity. Option B. Record only the patient's subjective complaint of discomfort and dryness, without further objective eyelid findings. Option C. Note that the patient has dry eye and recommend artificial tears. Option D. Describe the findings as general eyelid inflammation and defer further assessment to the ophthalmologist. The correct answer is A. Document the presence of mild erythema, telangiectasias, and inspissated secretions at the meibomian gland orifices, noting their location and severity. Explanation. Scenario analysis. This scenario presents a common challenge in ophthalmic practice, differentiating between normal physiological variations and signs of pathology affecting the eyelids and their associated glands. A certified ophthalmic medical technologist, COMT, must possess a thorough understanding of eyelid anatomy, the function of glands like meibomian, Zeiss, and Moll, and the clinical presentations of common conditions. Misinterpreting these findings can lead to delayed diagnosis, inappropriate treatment, and patient discomfort or vision impairment. The challenge lies in applying theoretical knowledge to a practical clinical observation, requiring accurate identification and appropriate reporting. Correct approach analysis. The correct approach involves a systematic evaluation of the eyelid margin and surrounding structures, specifically looking for signs of inflammation, obstruction, or abnormal secretions from the meibomian, Zeiss, and Moll glands. This includes assessing for erythema, edema, telangiectasias, inspissated secretions, or the presence of discrete lesions. The COMT role is to gather objective clinical data that accurately describes the observed findings, enabling the ophthalmologist to make a definitive diagnosis and treatment plan. This aligns with the COMT scope of practice, which emphasizes accurate data collection and patient assessment under the supervision of an ophthalmologist, adhering to established clinical protocols and ethical standards of care. Incorrect approach is analysis. An incorrect approach would be to dismiss subtle findings as insignificant without a thorough examination, potentially overlooking early signs of conditions like blepharitis or meibomian gland dysfunction. This failure to meticulously assess the eyelid structures and gland orifices violates the professional obligation to provide comprehensive patient care and accurate diagnostic support. Another incorrect approach would be to make a presumptive diagnosis without sufficient objective findings or to recommend treatment, as this exceeds the COMT scope of practice and could lead to misdiagnosis or inappropriate management. Finally, focusing solely on the visual acuity without a detailed examination of the ocular adnexa would be a significant oversight, as eyelid health directly impacts ocular surface health and comfort. Professional reasoning. Professionals should approach such scenarios by first recalling the detailed anatomy and physiology of the eyelids and their glands. This knowledge forms the foundation for a systematic clinical examination. The process involves 1. Visual inspection of the entire eyelid margin, noting any redness, swelling, or abnormalities. 2. Palpation of the eyelids for tenderness or masses. 3. Eversion of the eyelids to examine the conjunctiva and tarsal plates. 4. Specific assessment of the meibomian gland orifices for signs of blockage or inflammation, and evaluation of the quality of meibomian secretions. 5. Observation for any lesions associated with the glands of Zeiss or Moll. 6. Documentation of all findings clearly and concisely for the ophthalmologist. This systematic approach ensures all relevant structures are evaluated, leading to accurate data collection and informed clinical decision-making by the supervising physician. Question 3. Strategic planning requires the certified ophthalmic medical technologist, COMT, to anticipate patient needs and ensure the efficient and accurate execution of diagnostic procedures for suspected open-angle glaucoma. Considering the COMT scope of practice and ethical obligations, which of the following represents the most appropriate approach when interacting with a patient undergoing these diagnostic evaluations? Option A. Focus solely on the technical execution of the diagnostic tests, assuming the ophthalmologist will handle all patient communication and explanations. Option B. Perform the diagnostic tests and then verbally explain the preliminary findings to the patient, offering initial thoughts on the potential diagnosis. Option C. Conduct all diagnostic tests as quickly as possible to minimize patient discomfort and maximize clinic throughput, with minimal verbal interaction. Option D. Perform all prescribed diagnostic tests for open-angle glaucoma, including visual field testing, gonioscopy, and optic nerve imaging, while providing the patient with clear, concise explanations of each procedure's purpose and what to expect. The correct answer is D. Perform all prescribed diagnostic tests for open-angle glaucoma, including visual field testing, gonioscopy, and optic nerve imaging, while providing the patient with clear, concise explanations of each procedure's purpose and what to expect. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the COMT to balance the immediate need for accurate diagnostic information with the patient's potential anxiety and the ethical imperative to provide clear, understandable explanations. The COMT must act as a bridge between the physician's diagnostic process and the patient's understanding, ensuring that the diagnostic steps are performed correctly and that the patient feels informed and respected. This involves not only technical proficiency, but also strong communication and ethical judgment within the scope of practice. Correct approach analysis. The correct approach involves the COMT meticulously performing all prescribed diagnostic tests for suspected open-angle glaucoma, including visual field testing, gonioscopy, and optic nerve imaging, while simultaneously providing the patient with clear, concise explanations of each procedure's purpose and what to expect. This approach is justified by the COMT role in assisting the ophthalmologist in diagnosis and management, as outlined by the Joint Commission on Allied Health Personnel in Ophthalmology, JCOPO, practice guidelines. These guidelines emphasize the technologist's responsibility for accurate data collection and patient education within their scope. By explaining procedures, the COMT upholds the ethical principle of patient autonomy and informed consent, ensuring the patient understands the diagnostic process, which is crucial for adherence to treatment plans. Incorrect approach is analysis. An approach that involves performing tests without explanation fails to uphold the ethical principle of patient autonomy and informed consent. Patients have a right to understand what is being done to them, and withholding this information can lead to anxiety, distrust, and noncompliance. This also falls short of the COMT responsibility to facilitate patient understanding as part of the care team. An approach that involves the COMT attempting to interpret the diagnostic findings or provide a definitive diagnosis is a regulatory and ethical failure. The COMT scope of practice, as defined by JCOPO, does not include diagnosis or treatment planning. These are the responsibilities of the ophthalmologist. Overstepping these boundaries constitutes practicing medicine without a license and undermines the established healthcare hierarchy. An approach that involves rushing through the diagnostic tests to save time, without proper patient explanation or ensuring the accuracy of each step, compromises the integrity of the diagnostic data. This directly impacts the ophthalmologist's ability to make an accurate diagnosis and treatment plan, potentially leading to suboptimal patient care and violating the COMT duty of care and professional responsibility for accurate data collection. Professional reasoning. Professionals should approach patient care by first understanding their role and scope of practice within the regulatory framework, JCOPO guidelines for COMT. This involves prioritizing accurate data collection and patient education. When faced with a diagnostic scenario, the professional reasoning process should involve 1. Identifying the specific diagnostic tests required for the suspected condition. 2. Planning the execution of these tests with meticulous attention to detail and accuracy. 3. Integrating patient communication by explaining each step, its purpose, and what the patient will experience, thereby fostering trust and understanding. 4. Recognizing the boundaries of their role and referring any diagnostic interpretation or treatment decisions to the supervising ophthalmologist. This systematic approach ensures both technical competence and ethical patient care. Question 4. Strategic planning requires a comprehensive understanding of the cellular landscape within ocular structures. When examining a specimen from the iris and ciliary body, what is the most accurate method for differentiating between the pigmented epithelium of the iris, the stromal melanocytes, and the non-pigmented ciliary epithelium, considering their distinct morphological characteristics and typical locations? Option A. Relying solely on the intensity of pigment granules within the cells and their general location within the anterior segment. Option B. Assuming all pigmented cells in these regions are identical and grouping them under a general pigment cell category. Option C. Differentiating based on nuclear shape, cytoplasmic features, cellular arrangement, and specific anatomical location within the iris and ciliary body. Option D. Focusing only on the presence or absence of a visible nucleus in the observed cells. The correct answer is A. Relying solely on the intensity of pigment granules within the cells and their general location within the anterior segment. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying and differentiating cellular structures within the iris and ciliary body, which is fundamental to diagnosing various ocular conditions. The COMT role demands precise observation and interpretation of microscopic findings. Misidentification can lead to incorrect diagnoses, inappropriate treatment plans, and potentially adverse patient outcomes. The challenge lies in the subtle morphological differences between cell types and the potential for artifacts or variations in staining that can obscure clear identification. This requires not only knowledge of cellular anatomy, but also practical skills in microscopy and image interpretation, all within the scope of practice defined by COMT certification. Correct approach analysis. The correct approach involves meticulous examination of cellular morphology, including nuclear shape, cytoplasmic characteristics, and arrangement, in conjunction with an understanding of the typical distribution of cells within the iris and ciliary body. Specifically, identifying the pigmented epithelium of the iris and ciliary body, the stromal melanocytes, and the non-pigmented ciliary epithelium requires careful observation of these features. Regulatory frameworks for ophthalmic medical technologists emphasize the importance of accurate data collection and reporting, which directly impacts patient care. The COMT certification itself signifies a level of competency in these diagnostic procedures, implying adherence to established clinical protocols and ethical standards that prioritize patient well-being through accurate assessment. Incorrect approach is analysis. One incorrect approach is to rely solely on the presence or absence of pigment without considering other morphological features. While pigment is a key characteristic, other cells, such as stromal melanocytes, also contain pigment, and their morphology differs from the epithelial layers. This superficial assessment can lead to misclassification. Another incorrect approach is to generalize findings across different anatomical regions without specific identification. The iris and ciliary body have distinct cellular compositions, and assuming uniformity can result in diagnostic errors. For instance, mistaking stromal cells for epithelial cells or vice versa would be a significant failure. A third incorrect approach is to disregard subtle variations in cell shape or nuclear characteristics, attributing them to artifacts without proper investigation. This can lead to overlooking early signs of pathology. These failures violate the COMT responsibility to conduct thorough and accurate examinations, as mandated by professional standards and ethical guidelines that underpin the certification. Professional reasoning. Professionals facing this situation should employ a systematic approach. First, they must confirm their understanding of the normal histology and cytology of the iris and ciliary body, as per established ophthalmic texts and training materials relevant to the COMT certification. Second, they should utilize high-quality microscopy and appropriate illumination to maximize visualization of cellular details. Third, they should compare observed features against known characteristics of specific cell types, considering nuclear morphology, cytoplasmic features, and cellular arrangement. If uncertainty exists, consulting with a supervising ophthalmologist or referencing validated diagnostic atlases is crucial. This iterative process of observation, comparison, and consultation ensures diagnostic accuracy and upholds the ethical obligation to provide competent patient care. Question 5. The audit findings indicate a potential discrepancy in how the ciliary body's role in aqueous humor production was assessed during a recent patient examination. Which of the following represents the most appropriate initial step for the certified ophthalmic medical technologist, COMT, to take in addressing this finding? Option A. Review the technologist's documentation and compare it against established guidelines for assessing ciliary body function and aqueous humor dynamics. Option B. Assume the audit finding is a minor procedural oversight and proceed with standard patient care without further investigation. Option C. Initiate a formal retraining program for all staff on the anatomy and physiology of the ciliary body. Option D. Immediately inform the patient that their examination may have been compromised due to an issue with ciliary body assessment. The correct answer is A. Review the technologist's documentation and compare it against established guidelines for assessing ciliary body function and aqueous humor dynamics. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from an audit finding that suggests a potential deviation from established protocols in assessing ciliary body function. The challenge lies in interpreting the audit's implication. Whether the technologist's actions were a deliberate, albeit misguided, attempt to gather more information, or a procedural error due to a lack of understanding of the ciliary body's role in accommodation and aqueous humor production. The technologist's judgment is critical in determining the appropriate response, balancing patient care, regulatory compliance, and professional integrity. The audit's vagueness necessitates a careful risk assessment to avoid misinterpreting the findings or overreacting. Correct approach analysis. The correct approach involves a thorough review of the technologist's documentation and the specific audit finding. This entails cross-referencing the technologist's actions with the certified ophthalmic medical technologist, COMT, scope of practice, relevant ophthalmic imaging guidelines, and established protocols for assessing ciliary body function. The COMT certification implies a commitment to adhering to these standards. If the audit suggests a deviation from accepted practice in evaluating the ciliary body's role in accommodation or aqueous humor production, the technologist must understand the specific aspect of the ciliary body's function that was potentially mishandled. This understanding is crucial for accurate patient care and for addressing the audit's concerns effectively. The regulatory framework for COMT emphasizes accurate data collection and appropriate diagnostic techniques. Therefore, a detailed review ensures that the technologist's actions align with these requirements, particularly concerning the ciliary body's dual roles. Incorrect approaches analysis. Dismissing the audit finding without investigation is an incorrect approach because it demonstrates a disregard for quality assurance and potential patient safety issues. This failure to engage with the audit process violates the professional responsibility to maintain high standards of practice, as expected of a COMT. Immediately implementing disciplinary action without a thorough understanding of the technologist's actions and the specific nature of the audit finding is also an incorrect approach. This premature action can lead to unfair consequences and does not address the root cause of the potential issue. It bypasses the necessary steps of fact-finding and professional development, which are integral to maintaining a competent workforce. Focusing solely on the technologist's intent without examining the objective evidence of their actions and their impact on patient assessment is another incorrect approach. While intent can be a factor, the primary concern in a clinical setting is the accuracy and appropriateness of the diagnostic process, especially concerning the ciliary body's critical function. This approach neglects the objective standards of practice that COMT are held to. Professional reasoning. Professionals facing such audit findings should adopt a systematic approach. First, they must fully comprehend the specific audit concern, relating it to the ciliary body's known functions of accommodation and aqueous humor production. Second, they should gather all relevant documentation and evidence pertaining to the technologist's actions. Third, they must consult the COMT scope of practice, relevant clinical guidelines, and institutional protocols to determine if a deviation from standard practice occurred. Fourth, if a deviation is identified, a constructive conversation with the technologist should ensue to understand their perspective and identify any knowledge gaps. Finally, appropriate corrective actions, which may include further training or protocol reinforcement, should be implemented based on the findings, always prioritizing patient well-being and adherence to regulatory standards. Question 6. Compliance review shows that a certified ophthalmic medical technologist, COMT, is performing optical coherence tomography, OCT scans of a patient's retina. Which of the following approaches best reflects the COMT responsibility in documenting the findings related to the retinal layers, photoreceptors, and retinal vasculature? Option A. Documenting the overall clarity of the scan and noting any obvious large-scale abnormalities in the retina, such as significant edema or detachment. Option B. Focusing primarily on the optic nerve head appearance and making general comments about the peripheral retina without specific detail on the layers or vasculature. Option C. Meticulously documenting the integrity of each retinal layer, the appearance and continuity of the photoreceptor inner and outer segments, and the caliber course and any pathological changes, e.g., hemorrhages, exudates of the retinal vasculature. Option D. Providing a brief summary of the scan quality and stating that the retina appears normal if no immediate, striking pathology is visible to the untrained eye. The correct answer is A. Documenting the overall clarity of the scan and noting any obvious large-scale abnormalities in the retina, such as significant edema or detachment. Explanation. This scenario presents a professional challenge because the COMT is tasked with interpreting and documenting findings related to the retina, a complex structure with critical functions. Accurate documentation is paramount for patient care, continuity of care, and potential legal or insurance purposes. Misinterpreting or inadequately documenting the layers, photoreceptors, or retinal vasculature can lead to misdiagnosis, delayed treatment, or inappropriate management by the ophthalmologist. The COMT must demonstrate a thorough understanding of normal retinal anatomy and physiology to identify deviations and communicate them effectively. The correct approach involves meticulously documenting the observed state of the retinal layers, specifically noting the integrity and appearance of the photoreceptor inner and outer segments, rods and cones, and the retinal vasculature, including the caliber, tortuosity, and presence of any hemorrhages or exudates. This approach aligns with the COMT role as a skilled interpreter of ophthalmic imaging and diagnostic tests, ensuring that all relevant findings are captured for the ophthalmologist's review. This adheres to the ethical obligation of providing accurate and comprehensive patient data, which is a cornerstone of professional practice in ophthalmic medical technology. While specific COMT certification guidelines may not explicitly detail every possible retinal finding, the overarching principle of accurate and thorough documentation of diagnostic findings is universally expected and implicitly required for competent practice. An incorrect approach that focuses solely on gross abnormalities without detailing the specific retinal layers or photoreceptor integrity fails to provide the necessary granular information for a complete ophthalmological assessment. This omission can lead to a superficial understanding of the patient's condition and hinder the ophthalmologist's diagnostic process. Another incorrect approach that prioritizes speed over accuracy by making assumptions about the retinal structures without direct observation or proper imaging interpretation is a direct violation of professional responsibility and could lead to significant patient harm. Furthermore, an approach that documents findings in vague or subjective terms, rather than using precise anatomical and pathological descriptors, compromises the clarity and utility of the report for other healthcare professionals. These failures represent a breach of the COMT duty to provide precise and objective data. Professionals should approach such situations by first ensuring they have a clear understanding of the diagnostic protocol and the specific imaging modality being used. They should then systematically evaluate the retinal structures, paying close attention to the requested elements, layers, photoreceptors, and vasculature. If any aspect is unclear or appears abnormal, the COMT should consult with the supervising ophthalmologist or refer to established diagnostic criteria and imaging atlases. The documentation should be objective, detailed, and use standardized terminology. This systematic, evidence-based approach ensures that all critical information is captured accurately and communicated effectively, upholding the highest standards of patient care and professional integrity. Question 7. Compliance review shows that a COMT is analyzing optical coherence tomography, OCT, scans of a patient presenting with progressive vision loss. The scans reveal significant thinning and disorganization within the outer nuclear layer and the photoreceptor inner and outer segments, with evidence of reduced reflectivity in the outer segments. Additionally, there is a noticeable decrease in the density of the ganglion cell layer and interplexiform layer. Based on these findings, which approach best reflects the COMT responsibility in interpreting this diagnostic data? Option A. Evaluate the reflectivity of the choroid and sclera, as these layers provide crucial information about the overall health of the posterior segment. Option B. Focus on the overall retinal thickness and the presence of any intraretinal cysts, as these are primary indicators of retinal pathology. Option C. Systematically assess the integrity and morphology of photoreceptors, bipolar cells, ganglion cells, and Mueller cells within the OCT scan to correlate with the patient's symptoms and guide further ophthalmologist evaluation. Option D. Prioritize the identification of any epiretinal membrane formation and its degree of wrinkling on the internal limiting membrane. The correct answer is B. Focus on the overall retinal thickness and the presence of any intraretinal cysts, as these are primary indicators of retinal pathology. Explanation: scenario analysis. This scenario presents a professional challenge because it requires the certified ophthalmic medical technologist, COMT, to interpret complex diagnostic imaging data in the context of a patient's specific retinal pathology. The challenge lies in accurately correlating the observed cellular morphology and distribution with the known functional roles of different retinal cell types, and then determining the most appropriate diagnostic pathway based on these findings. Misinterpretation can lead to delayed or incorrect diagnoses, impacting patient care and potentially leading to adverse outcomes. Careful judgment is required to synthesize information from imaging, patient history, and knowledge of retinal physiology. Correct approach analysis. The correct approach involves a systematic evaluation of the imaging findings, specifically identifying the characteristic features of photoreceptors, bipolar cells, ganglion cells, and Mueller cells. This includes assessing their density, morphology, and spatial relationships. For instance, photoreceptor integrity is crucial for light detection. Bipolar cells transmit signals from photoreceptors to ganglion cells. Ganglion cells are the output neurons of the retina, and Mueller cells provide structural and metabolic support. By recognizing abnormalities in these cell types, such as photoreceptor degeneration, altered bipolar cell connectivity, or ganglion cell loss, the COMT can accurately infer the underlying retinal disease process. This aligns with the COMT responsibility to perform and record diagnostic tests and procedures, and to assist the ophthalmologist in diagnosis and management. The regulatory framework for COMT emphasizes accurate data collection and interpretation to support clinical decision-making. Incorrect approach is analysis, an approach that focuses solely on the overall retinal thickness without considering the specific cellular layers, and their integrity is incorrect. This is because retinal thickness can be affected by various factors, and a general measurement does not provide the detailed cellular information needed for a precise diagnosis. This fails to meet the standard of care for detailed ophthalmic imaging analysis, an approach that prioritizes the identification of drusen without correlating them to the health of the overlying photoreceptors and underlying retinal pigment epithelium is also incorrect. While drusen are significant in certain conditions like age-related macular degeneration, their impact is determined by their effect on adjacent retinal cells. Ignoring the cellular consequences of drusen formation represents an incomplete diagnostic assessment, an approach that exclusively analyzes the optic nerve head without assessing the integrity of the retinal nerve fiber layer, which is composed of ganglion cell axons, is incorrect. The optic nerve head's appearance is directly linked to the health of the ganglion cell population. A comprehensive evaluation requires examining both the source, ganglion cells, and the exit point, optic nerve head. This oversight would miss crucial information about conditions affecting the optic nerve. Professional reasoning. When faced with complex retinal imaging, a COMT should employ a structured approach. First, thoroughly review the patient's clinical history and the reason for the imaging. Second, systematically examine the imaging modality, paying close attention to each retinal layer and its constituent cell types. Correlate any observed abnormalities with the known functions of photoreceptors, bipolar cells, ganglion cells, and Mueller cells. Third, consider how these cellular changes might manifest clinically and what further diagnostic steps or referrals might be indicated. This systematic, cell-centric analysis ensures that the diagnostic information gathered is comprehensive and directly supports the ophthalmologist's diagnostic and management decision, adhering to professional standards and regulatory expectations for accurate patient care. Question 8. The evaluation methodology shows a patient with suspected early glaucomatous changes. Spectral domain optical coherence tomography, SDOCT, reveals localized thinning in the superior arcuate nerve fiber layer. Concurrently, immunohistochemical staining of a biopsy specimen, hypothetically, for educational purposes, demonstrates increased expression of glial fibrillary acidic protein, GFAP, in the optic nerve head region corresponding to the thinned RNFL. Considering the role of glial cells in optic nerve health and disease, which interpretation best reflects the integrated findings? Option A. The RNFL thinning is likely due to a refractive error, and the GFAP expression is an artifact of the staining process. Option B. The increased GFAP expression indicates reactive astrogliosis, a common response to axonal damage, supporting the SDOCT finding of RNFL thinning as indicative of glaucomatous neurodegeneration. Option C. The increased GFAP expression suggests an inflammatory process unrelated to glaucoma, and the RNFL thinning is coincidental. Option D. The increased GFAP expression is a normal finding in healthy optic nerves and is unrelated to the observed RNFL thinning. The correct answer is B. The increased GFAP expression indicates reactive astrogliosis, a common response to axonal damage, supporting the SDOCT finding of RNFL thinning as indicative of glaucomatous neurodegeneration. Explanation. The evaluation methodology shows a patient presenting with a suspected visual field defect. The challenge lies in accurately interpreting the subtle changes in optic nerve fiber layer, RNFL thickness, and correlating these findings with the presence and distribution of glial cells, specifically astrocytes and Mueller cells, which play crucial roles in retinal health and optic nerve integrity. Misinterpreting these microscopic and submicroscopic changes can lead to misdiagnosis, delayed treatment, or unnecessary interventions, impacting patient outcomes. Professional judgment is required to integrate imaging data, clinical presentation, and knowledge of ocular anatomy and pathology. The correct approach involves a comprehensive assessment that integrates optical coherence tomography, OCT, imaging of the RNFL, with a thorough understanding of the cellular architecture of the optic nerve head. This includes recognizing that thinning of specific RNFL sectors on OCT, particularly in the superior and inferior arcuate bundles, is a hallmark of glaucomatous damage. Furthermore, understanding the role of glial cells, such as the proliferation of astrocytes and reactive changes in Mueller cells, in response to axonal damage is critical for a complete picture. This approach aligns with the COMT scope of practice, which includes performing and assisting with diagnostic imaging, and understanding the underlying pathophysiology of ocular diseases. Regulatory frameworks for ophthalmic medical technologists emphasize accurate data acquisition and preliminary interpretation within their defined competencies, supporting the integration of imaging findings with cellular pathology knowledge. An incorrect approach would be to solely rely on RNFL thickness measurements from OCT, without considering the potential contribution of glial cell changes to the observed structural alterations, or the clinical context. This overlooks the dynamic cellular processes that accompany axonal degeneration. Another incorrect approach would be to focus on glial cell morphology in isolation without correlating it with objective RNFL measurements, leading to an incomplete diagnostic picture. A third incorrect approach would be to overinterpret subtle RNFL variations as pathological without considering normal anatomical variations or potential artifacts, failing to adhere to the principle of accurate data interpretation. These approaches fail to meet the standard of care expected of a COMT, which necessitates a holistic and integrated interpretation of diagnostic findings. Professional decision-making in such scenarios requires a systematic process. First, accurately acquire all relevant diagnostic data, e.g., OCT scans, visual fields. Second, analyze the data for deviations from normal anatomical and physiological parameters, considering the known pathological changes associated with specific conditions. Third, integrate these findings with the patient's clinical history and symptoms. Finally, communicate these integrated findings clearly and concisely to the supervising ophthalmologist, adhering to established reporting guidelines and ethical principles of patient care. Question 9. The control framework reveals that a 65-year-old patient presents with new onset, intermittent flashes of light in their peripheral vision and reports seeing several small, dark specks that drift across their visual field, particularly noticeable when looking at a bright background. Based on the COMT understanding of the vitreous humor structure, function, and age-related changes, which of the following best guides the technologist's immediate actions and interpretation of these symptoms? Option A. Recognize these symptoms as typical age-related vitreous liquefaction and posterior vitreous detachment, requiring only routine follow-up. Option B. Immediately assume the patient is experiencing a retinal tear due to the presence of flashes and floaters, and initiate emergency referral protocols. Option C. Understand that these symptoms are indicative of age-related changes in the vitreous, such as liquefaction and potential posterior vitreous detachment, and necessitate a thorough ophthalmic examination to rule out associated retinal pathology. Option D. Focus solely on the structural integrity of the vitreous gel and disregard the patient's subjective visual complaints as non-significant. Correct answer is A. Recognize these symptoms as typical age-related vitreous liquefaction and posterior vitreous detachment, requiring only routine follow-up. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified ophthalmic medical technologist, COMT, to integrate knowledge of ocular anatomy and physiology with the understanding of age-related changes, specifically concerning the vitreous humor. The challenge lies in accurately assessing and interpreting subtle structural and functional alterations that can impact visual perception and potentially indicate underlying pathology. A COMT must not only possess this knowledge, but also apply it judiciously in patient care, ensuring that observations are communicated effectively and contribute to a comprehensive diagnostic process. Misinterpreting these changes could lead to delayed diagnosis or inappropriate management, highlighting the critical need for precise and informed decision-making. Correct approach analysis. The correct approach involves recognizing that the vitreous humor, a gel-like substance filling the posterior cavity of the eye, undergoes significant structural and functional changes with age. These changes include liquefaction, synthesis, where the gel structure breaks down into a more fluid state, and posterior vitreous detachment, PVD, where the vitreous membrane separates from the retina. Functionally, these alterations can lead to the perception of floaters, muscae volitantes, and flashes of light, photopsia, as the vitreous tugs on the retina or as liquefied vitreous casts shadows. COMT role is to identify these phenomena, understand their common association with aging, and differentiate them from more serious conditions like retinal tears or detachment, which may present with similar symptoms but require immediate medical intervention. This approach aligns with the COMT responsibility to gather accurate patient data and assist the ophthalmologist in diagnosis and treatment planning, adhering to the standards of care expected within the ophthalmic medical technology profession. Incorrect approach is analysis. An incorrect approach would be to dismiss the patient's reported symptoms of floaters and flashes as merely a normal part of aging without further investigation. This fails to acknowledge the potential for PVD to be associated with retinal tears, a serious complication that requires prompt ophthalmological evaluation. Ethically and professionally, a COMT must not assume a diagnosis, but rather collect all relevant clinical information. Another incorrect approach would be to focus solely on the structural changes of the vitreous e.g. liquefaction, without considering the functional implications for the patient's vision and potential symptoms. This narrow focus overlooks the patient's subjective experience and the diagnostic significance of their reported visual disturbances. A third incorrect approach would be to attribute all vitreous-related symptoms solely to age-related changes without considering other potential etiologies, such as inflammation, hemorrhage, or trauma, which can also affect the vitreous. This oversimplification can lead to a misdiagnosis of a treatable condition. Professional reasoning. Professionals should employ a systematic approach when evaluating patients reporting vitreous-related symptoms. This involves 1. Active listening and symptom characterization, thoroughly documenting the nature, onset, duration, and characteristics of floaters and flashes. 2. Anatomical and physiological understanding, recalling the structure of the vitreous and its normal aging process, including synthesis and PVD. 3. Differential diagnosis consideration, recognizing that while age-related changes are common, these symptoms can also signal more urgent conditions. 4. Clinical observation and testing, performing appropriate ophthalmic tests, e.g., visual acuity, slit lamp examination, dilated fundus examination, to assess the vitreous and retina. 5. Communication and collaboration, clearly and accurately reporting findings to the supervising ophthalmologist, facilitating timely and appropriate patient management. Question 10. Quality control measures reveal an unexpected hypoechoic shadowing artifact obscuring a significant portion of the choroidal vasculature in a B-scan ultrasound image. The technologist is confident the patient was cooperative and stationary during the scan. What is the most appropriate initial step to address this imaging anomaly? Option A. Review and adjust the ultrasound machine's gain, frequency, and focal zone settings, and re-image the area to assess for artifact reduction. Option B. Immediately increase the overall image brightness and contrast in the post-processing software to improve visualization of the choroid. Option C. Proceed with image interpretation, assuming the shadowing is a normal anatomical variation of the choroid in this specific patient. Option D. Document the shadowing as a significant finding and report it to the referring physician without further technical investigation. The correct answer is A. Review and adjust the ultrasound machine's gain, frequency, and focal zone settings, and re-image the area to assess for artifact reduction. Explanation. Scenario analysis. This scenario presents a challenge in maintaining the integrity of diagnostic imaging data, specifically concerning the choroid. As a certified ophthalmic medical technologist, COMT, the technologist is responsible for acquiring high-quality images that accurately represent ocular structures. Inaccurate or misleading imaging of the choroid, a critical vascular layer, can lead to misdiagnosis, inappropriate treatment, and potentially adverse patient outcomes. The challenge lies in identifying the source of the artifact and implementing a corrective action that upholds diagnostic accuracy and patient safety, all within the scope of practice and regulatory guidelines. Correct approach analysis. The correct approach involves meticulously reviewing the imaging protocol and equipment settings used for the specific patient. This includes verifying the correct transducer frequency, gain settings, focal zone placement, and image depth, all of which directly influence the visualization of the choroid. The technologist must also consider potential patient-related factors that might cause shadowing or attenuation, such as dense cataracts or intraocular lenses, and document these observations. This systematic, evidence-based approach ensures that any identified artifact is either a true pathological finding or a correctable technical issue, rather than a misinterpretation of the image. This aligns with the COMT ethical obligation to provide accurate and reliable diagnostic information, as mandated by professional standards and implied by regulatory frameworks governing medical imaging quality and patient care. The focus is on understanding how technical parameters interact with ocular anatomy, specifically the choroid structure and blood supply, to produce the observed image. Incorrect approaches analysis. Ignoring the artifact and proceeding with image interpretation without investigation is a failure to uphold the technologist's duty of care. This bypasses the fundamental responsibility to ensure image quality and diagnostic accuracy, potentially leading to misdiagnosis. It violates the principle of providing reliable data for clinical decision-making. Attributing the artifact solely to patient movement without a thorough technical review is premature and unprofessional. While patient movement can cause artifacts, it is crucial to rule out technical factors first, as these are within the technologist's direct control. This approach neglects the technologist's responsibility to optimize imaging parameters and could lead to overlooking a correctable technical flaw. Adjusting image processing software settings to hide the artifact without understanding its origin is a form of data manipulation. This compromises the integrity of the original image data and misrepresents the actual ocular structures, including the choroid. It is ethically unsound and violates the principle of truthful representation of diagnostic findings. Professional reasoning. Professionals facing such a situation should employ a systematic problem-solving process. First, clearly define the observed anomaly. Second, identify potential causes, categorizing them into technical, patient-related, and equipment-related factors. Third, systematically investigate each potential cause, prioritizing those within the technologist's direct control technical settings. Fourth, document all findings and actions taken. Fifth, consult with a supervisor or senior clinician if the cause remains unclear or if the anomaly significantly impacts diagnostic interpretation. This structured approach ensures that all avenues are explored, leading to the most accurate and ethically sound resolution, thereby protecting patient welfare and maintaining professional standards. Question 11. What factors determine the appropriate level of family involvement when discussing optic nerve structure, function, and visual pathway abnormalities with a patient who appears to have difficulty comprehending the diagnostic findings? Option A. The urgency of the diagnosis and the perceived need for immediate family intervention, regardless of the patient's consent. Option B. The technologist's personal relationship with the patient's family and their assessment of the family's understanding of ophthalmic terminology. Option C. The patient's expressed desire for family involvement, their capacity to understand the information, and the technologist's professional judgment in facilitating communication while respecting patient privacy. Option D. The availability of family members at the time of the appointment, and the technologist's desire to expedite the diagnostic process. The correct answer is C. The patient's expressed desire for family involvement, their capacity to understand the information, and the technologist's professional judgment in facilitating communication while respecting patient privacy. Explanation. This scenario presents an ethical dilemma common in ophthalmic practice, where a technologist must balance patient privacy with the need to obtain accurate diagnostic information. The challenge lies in respecting patient autonomy and confidentiality, while ensuring the highest standard of care, which may necessitate involving a family member in understanding complex visual pathway information. The technologist must navigate this delicate balance without overstepping professional boundaries or violating patient rights. The correct approach involves a nuanced discussion with the patient about the benefits and risks of involving a family member, respecting their decision while exploring alternatives. This aligns with ethical principles of patient autonomy and informed consent, as well as regulatory guidelines that emphasize patient privacy and the technologist's role in facilitating communication. Specifically, the Certified Ophthalmic Medical Technologist (COMT) certification implies adherence to ethical codes that prioritize patient well-being and confidentiality. The technologist's responsibility is to educate the patient about their condition and treatment options, empowering them to make informed decisions. If the patient consents, the technologist can then facilitate communication with the family member, ensuring that the patient's wishes are respected throughout the process. An incorrect approach would be to unilaterally involve the family member without the patient's explicit consent. This violates patient confidentiality and autonomy, potentially eroding trust and leading to legal or ethical repercussions. Another incorrect approach is to refuse to involve the family member even when the patient expresses a desire for their support and understanding, especially if the patient's cognitive state or the complexity of the diagnosis makes it difficult for them to fully grasp the information alone. This could be seen as failing to provide adequate patient education and support. Finally, providing incomplete or misleading information to either the patient or the family member, regardless of intent, is ethically unacceptable and undermines the diagnostic and therapeutic process. Professionals should employ a decision-making framework that begins with understanding the patient's capacity and preferences. This involves open communication, active listening, and a thorough assessment of the patient's understanding. If the patient struggles with comprehension or expresses a desire for support, the technologist should explore options for involving a trusted individual, always prioritizing patient consent and privacy. This process ensures that the technologist acts as a patient advocate, facilitating informed decision-making and upholding ethical standards. Question 12. Examination of the data shows a patient presenting with a history of progressive vision loss. The recorded full-field electroretinogram, FF-ERG, demonstrates reduced amplitudes for both scotopic and photopic responses, with a prolonged implicit time for the photopic B wave. The simultaneous pattern visual evoked potential, PVEP, shows a significant delay in the P100 latency and reduced amplitude. Considering the patient's symptoms and the electrophysiological findings, which of the following represents the most appropriate next step in interpreting and reporting these results? Option A. Focus solely on the reduced FF-ERG amplitudes, attributing the findings to a severe photoreceptor degeneration, and disregard the PVEP results as potentially artifactual due to the patient's poor vision. Option B. Report the FF-ERG and PVEP findings as presented, without further analysis, and await further instructions from the ophthalmologist regarding interpretation. Option C. Conclude that the patient has a generalized retinal dysfunction affecting both rod and cone systems and a significant optic nerve pathway abnormality, and report these findings directly to the patient. Option D. Correlate the FFERG and PVEP findings with the patient's clinical history, visual acuity, refractive error, and fundus examination to formulate a differential diagnosis for the ophthalmologist. Correct answer is C. Conclude that the patient has a generalized retinal dysfunction affecting both rod and cone systems and a significant optic nerve pathway abnormality, and report these findings directly to the patient. Explanation. This scenario presents a professional challenge because it requires the certified ophthalmic medical technologist, COMT, to interpret complex electrophysiological data and correlate it with clinical findings, ensuring the diagnostic information is accurate and ethically presented to the physician. The challenge lies in discerning subtle patterns in ERG and VEP waveforms that might indicate specific retinal or optic nerve pathologies, and understanding the limitations of the testing modalities. Accurate interpretation is crucial for patient diagnosis and management, and any misinterpretation could lead to incorrect treatment or delayed diagnosis. The correct approach involves meticulously reviewing the recorded ERG and VEP waveforms, comparing them against established normative data for age and testing conditions, and noting any deviations. This includes assessing amplitude, latency, and waveform morphology for both rod and cone responses in ERG, and the P100 component and its latency/amplitude in VEP. Crucially, this approach necessitates correlating these electrophysiological findings with the patient's reported symptoms, visual acuity, refractive error, and any observed fundus abnormalities. This comprehensive correlation ensures that the electrophysiological results are interpreted within the full clinical context, maximizing diagnostic yield and minimizing the risk of misinterpretation. This aligns with the COMT responsibility to provide accurate and relevant data to the ophthalmologist, adhering to professional standards of care and ethical practice in diagnostic testing. An incorrect approach would be to solely focus on identifying abnormal waveforms without considering the clinical context. For instance, reporting a delayed VEP latency without investigating potential causes like refractive error, media opacity, or patient fixation issues would be a failure to provide a complete diagnostic picture. Similarly, interpreting ERG abnormalities in isolation without correlating them with fundus findings or patient history could lead to an incomplete or misleading assessment. Another incorrect approach would be to overinterpret subtle waveform variations as definitive pathology without sufficient evidence or established diagnostic criteria, potentially leading to unnecessary patient anxiety or further invasive testing. These approaches fail to meet the professional standard of care by not integrating all available information for a holistic interpretation. Professionals should approach such situations by adopting a systematic process. First, ensure the technical quality of the recorded data. Second, analyze the electrophysiological waveforms according to established protocols and normative data. Third, critically evaluate the clinical presentation and history. Fourth, synthesize the electrophysiological findings with the clinical data, identifying any discrepancies or corroborating evidence. Finally, document all findings and interpretations clearly and concisely for the referring ophthalmologist, highlighting any areas requiring further investigation. This structured approach ensures thoroughness, accuracy, and ethical reporting. Question 13. When evaluating the corneal endothelium for a patient scheduled for cataract surgery, which approach best aligns with the certified ophthalmic medical technologists, COMT, scope of practice, and the need for accurate diagnostic data? Option A. Ask the patient about any recent visual disturbances or discomfort to gauge endothelial health. Option B. Perform a specular microscopy examination to obtain endothelial cell density and morphology, ensuring proper focus and image clarity. Option C. Omit the endothelial cell count if the patient appears anxious, assuming the ophthalmologist can proceed without this specific data. Option D. Rely on slit lamp biomicroscopy to observe gross endothelial abnormalities, as this is a quicker assessment. Correct answer is B. Perform a specular microscopy examination to obtain endothelial cell density and morphology, ensuring proper focus and image clarity. Explanation. This scenario is professionally challenging because the Certified Ophthalmic Medical Technologist, COMT, must balance the immediate need for diagnostic information with the ethical obligation to avoid unnecessary patient discomfort or risk, all while adhering to established clinical protocols and the scope of practice. The integrity of endothelial cell assessment is paramount for patient care, particularly in preoperative evaluations for refractive surgery or cataract surgery, and for monitoring ocular health in conditions like Fuchs dystrophy. Precise and accurate data collection is essential for the ophthalmologist's diagnostic and treatment planning. The correct approach involves utilizing the specular microscope with appropriate magnification and focus to obtain clear images of the corneal endothelium, followed by manual or automated cell counting and morphology assessment. This method directly addresses the diagnostic objective by providing quantifiable data on endothelial cell density and pleomorphism. Regulatory frameworks governing COMT practice, such as those outlined by the Joint Commission on Allied Health Personnel in Ophthalmology, JCOPO, emphasize the technologist's role in performing diagnostic tests accurately and efficiently, contributing to the overall patient care plan. Ethical considerations also dictate minimizing patient discomfort. Therefore, proper technique and patient communication are crucial. An incorrect approach would be to proceed with a less precise or potentially uncomfortable method, such as attempting to assess endothelial cell health solely through slit lamp biomicroscopy without specialized equipment. While a skilled clinician can observe gross abnormalities of the endothelium with a slit lamp, it does not provide the quantitative data required for accurate cell density and morphology assessment, which is the core purpose of endothelial cell evaluation. This fails to meet the diagnostic standard expected of a COMT and could lead to misdiagnosis or inadequate treatment planning, violating the principle of providing competent patient care. Another incorrect approach would be to skip the endothelial cell count entirely due to perceived difficulty or time constraints, assuming the ophthalmologist can manage without it. This directly contradicts the COMT responsibility to perform ordered diagnostic tests and contribute essential data. It represents a failure to adhere to the established protocols and the technologist's defined role in the diagnostic process, potentially compromising patient safety and the quality of care. A third incorrect approach would be to rely solely on patient-reported symptoms to infer endothelial cell health. While patient symptoms are important, they are subjective and cannot replace objective, quantifiable diagnostic data. Endothelial dysfunction can be asymptomatic in its early stages, and symptoms like blurred vision or glare can have multiple etiologies. This approach neglects the technologist's duty to perform objective assessments and would be a significant deviation from accepted clinical practice and regulatory expectations for diagnostic accuracy. The professional decision-making process for similar situations should involve a clear understanding of the diagnostic objective, the available tools and techniques, and the established scope of practice for the COMT. It requires prioritizing patient safety and comfort while ensuring the accuracy and completeness of diagnostic data. When faced with a diagnostic task, the COMT should consult established protocols, seek clarification from the supervising ophthalmologist if needed, and utilize the most appropriate and validated methods to achieve the required clinical information. Question 14. Operational review demonstrates a patient presenting with a subtle, non-tender fullness in the superior temporal orbit, accompanied by a mild, intermittent ptosis of the upper eyelid. The COMT is tasked with performing an initial assessment of these eyelid and orbital structures. Which of the following approaches best reflects a risk assessment strategy for this presentation? Option A. Focus solely on measuring the degree of ptosis, disregarding the palpable fullness in the orbit as it is described as non-tender. Option B. Primarily rely on the patient's description of the fullness, assuming it is a minor age-related change and not requiring further detailed examination of the orbital structures. Option C. Systematically palpate the orbital rim and orbital contents, visually inspect the entire eyelid margin for irregularities, assess for any signs of inflammation or mass effect, and evaluate the range of ocular motility and visual field integrity, correlating these findings with the patient's reported symptoms and medical history. Option D. Immediately attribute the fullness to a common benign cyst and document it as such, focusing only on the ptosis as the primary concern. The correct answer is C. Systematically palpate the orbital rim and orbital contents, visually inspect the entire eyelid margin for irregularities, assess for any signs of inflammation or mass effect, and evaluate the range of ocular motility and visual field integrity, correlating these findings with the patient's reported symptoms and medical history. Explanation: scenario analysis. This scenario presents a professional challenge requiring the certified ophthalmic medical technologist, COMT, to interpret subtle clinical findings related to eyelid and orbital structures. The challenge lies in accurately differentiating between benign anatomical variations and potential pathological processes that could impact vision or ocular health. A misinterpretation could lead to delayed diagnosis, inappropriate treatment, or unnecessary patient anxiety. The COMT must apply detailed anatomical knowledge and a systematic risk assessment approach to ensure patient safety and optimal care. Correct approach analysis. The correct approach involves a thorough, systematic evaluation of the eyelid and orbital structures, correlating the observed findings with the patient's history and symptoms. This includes meticulous palpation, visual inspection for asymmetry, masses, or signs of inflammation, and assessment of ocular motility and visual fields if indicated. The COMT must then synthesize this information to form a differential diagnosis and communicate findings clearly to the supervising ophthalmologist. This aligns with the COMT scope of practice, emphasizing accurate data collection and preliminary assessment to support medical decision-making, as outlined in professional practice guidelines that stress the importance of comprehensive patient evaluation and accurate documentation. Incorrect approach is analysis, focusing solely on the most obvious or common findings without a comprehensive assessment risks overlooking critical, albeit less apparent, abnormalities. This approach fails to meet the standard of care by potentially missing early signs of serious conditions. Attributing all observed abnormalities to age-related changes without further investigation is a premature conclusion that bypasses the necessary diagnostic process. This can lead to misdiagnoses of conditions that, while potentially influenced by age, require specific medical intervention. Relying exclusively on patient self-reporting of symptoms without objective clinical correlation can lead to diagnostic errors. While patient history is vital, it must be corroborated by physical examination findings to ensure accuracy and avoid misdirection. Professional reasoning. Professionals should approach such situations by first activating their detailed anatomical knowledge of the eyelids and orbit. This is followed by a systematic clinical examination, beginning with a broad overview and then focusing on specific structures. The process involves comparing findings to established norms and considering potential deviations. Crucially, the COMT must maintain a high index of suspicion for pathology and avoid premature conclusions. Documenting all findings meticulously and communicating any concerns or significant observations to the supervising physician is paramount. This structured approach ensures that all relevant information is gathered and considered, leading to the most accurate and timely diagnosis. Question 15. Stakeholder feedback indicates that some patients undergoing binocular vision and depth perception testing report feeling anxious due to the unfamiliar equipment and the need to focus intently. As a certified ophthalmic medical technologist, COMT, what is the best practice approach when a patient expresses mild apprehension before initiating a stereopsis test? Option A. Suggest the patient reschedule the appointment for a time when they feel more relaxed without offering further explanation or support. Option B. Acknowledge the patient's feelings, briefly explain the purpose of the test in simple terms, and reassure them that you will guide them through each step, proceeding with the test at a comfortable pace. Option C. Inform the patient that apprehension is common and proceed with the test as quickly as possible to minimize their discomfort. Option D. Immediately administer a mild sedative to reduce the patient's anxiety before starting the stereopsis test. The correct answer is B. Acknowledge the patient's feelings, briefly explain the purpose of the test in simple terms, and reassure them that you will guide them through each step, proceeding with the test at a comfortable pace. Explanation. This scenario is professionally challenging because it requires the COMT to balance the need for accurate diagnostic information with the patient's comfort and potential anxiety. The COMT must ensure that the testing environment and methodology do not inadvertently compromise the integrity of the binocular vision and depth perception assessment. Adherence to established protocols and ethical considerations is paramount to avoid misdiagnosis or patient distress, which could have downstream implications for treatment and patient care. The correct approach involves systematically evaluating the patient's binocular vision and depth perception using standardized tests while maintaining a supportive and clear communication environment. This aligns with the COMT ethical obligation to provide competent and compassionate care, as outlined by professional standards and regulatory guidelines for ophthalmic medical personnel. Specifically, it emphasizes the importance of patient-centered testing that minimizes extraneous factors influencing results and ensures the patient understands the procedure. An incorrect approach that proceeds with testing, despite clear signs of patient discomfort or environmental distraction, fails to uphold the principle of patient well-being. This could lead to inaccurate test results, necessitating repeat testing and potentially delaying diagnosis or treatment. It also violates the ethical duty to ensure the patient is in a suitable condition to participate effectively in the examination. Another incorrect approach that prioritizes speed over thoroughness by skipping crucial steps in the binocular vision assessment, such as proper alignment or calibration of equipment, directly contravenes established diagnostic protocols. This not only compromises the validity of the findings, but also represents a failure to meet the expected standard of care for a COMT. Such shortcuts can lead to misinterpretations of the patient's visual status. A further incorrect approach that involves making assumptions about the patient's visual capabilities without objective testing is ethically unsound and professionally negligent. The COMT role is to gather objective data, not to infer findings. This bypasses the fundamental requirement for evidence-based assessment and could result in significant diagnostic errors. The professional decision-making process in such situation should involve a continuous assessment of the patient's state and the testing environment. If a patient exhibits distress or if the environment is suboptimal, the COMT should pause, address the issue, and if necessary, reschedule the test. Clear communication with the patient about the purpose of each step and reassurance are vital. The COMT must always prioritize the accuracy of the diagnostic information obtained through adherence to validated methodologies and ethical patient care principles. Question 16. Regulatory review indicates that a certified ophthalmic medical technologist, COMT, is performing a routine eye examination on a patient who reports intermittent blurred vision, particularly when shifting focus from distance to near. During the pupillary examination, the COMT observes that the pupils constrict briskly and symmetrically to direct light, and also constrict consensually when the fellow eye is illuminated. When the patient is asked to fixate on a near object, both pupils constrict, and the COMT notes a slight but perceptible convergence of the eyes. Considering the patient's subjective complaint and these objective findings, which of the following represents the most appropriate risk assessment and immediate next step for the COMT? Option A. Document the findings of brisk direct and consensual pupillary light reflexes and normal accommodation, but express concern to the ophthalmologist that the patient's subjective complaint of blurred vision, despite seemingly normal pupillary and accommodative responses, warrants further investigation for other potential causes of visual disturbance. Option B. Document the findings of brisk direct and consensual pupillary light reflexes and normal accommodation, and inform the ophthalmologist that the pupillary and accommodative responses appear within normal limits, suggesting the blurred vision may be unrelated to these specific functions. Option C. Focus solely on the brisk pupillary light reflexes, deeming them to be the most critical finding, and report that the pupillary light reflex is normal, without further comment on accommodation or the patient's subjective symptoms. Option D. Conclude that the patient's blurred vision is likely due to accommodative insufficiency given the slight convergence noted, and recommend a trial of reading glasses to the ophthalmologist. The correct answer is B. Document the findings of brisk direct and consensual pupillary light reflexes and normal accommodation, and inform the ophthalmologist that the pupillary and accommodative responses appear within normal limits, suggesting the blurred vision may be unrelated to these specific functions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified ophthalmic medical technologist, COMT, to interpret subtle findings related to the pupillary light reflex and accommodation in the context of a patient's reported symptoms. The challenge lies in differentiating between normal physiological responses and potential indicators of underlying pathology, which could impact patient care and require further investigation by the ophthalmologist. Accurate assessment is crucial to avoid misdiagnosis or delayed treatment. Correct approach analysis. The correct approach involves meticulously documenting the observed pupillary responses to light, direct and consensual, and during accommodation, noting any asymmetry, sluggishness, or absence of response. This detailed observation, coupled with a thorough history and correlation with other clinical findings, allows for a comprehensive assessment. Regulatory frameworks for COMT emphasize accurate data collection and reporting as foundational to patient safety and effective medical practice. The Joint Commission, for example, mandates that healthcare professionals collect and document patient information accurately to support clinical decision-making and continuity of care. Ethical guidelines also require technologists to act within their scope of practice and to report all findings objectively to the supervising physician. Incorrect approaches analysis. One incorrect approach would be to dismiss any observed pupillary abnormalities as insignificant without further detailed documentation and correlation, especially if the patient reports subjective visual disturbances. This failure to thoroughly investigate and document could violate standards of care and regulatory requirements for comprehensive patient assessment. Another incorrect approach would be to prematurely conclude a specific diagnosis based solely on pupillary findings, without considering the full clinical picture or consulting with the ophthalmologist. This oversteps the technologist's scope of practice and could lead to inappropriate patient management, contravening guidelines that define the roles and responsibilities of allied health professionals. A third incorrect approach would be to rely solely on automated testing equipment without manual verification or subjective observation of the patient's response, as technology can sometimes miss nuanced clinical presentations or be subject to artifact. This neglects the importance of the technologist's clinical judgment and observational skills, which are integral to a complete ophthalmic examination as outlined by professional competency standards. Professional reasoning. Professionals should approach such situations by first understanding the patient's chief complaint and relevant medical history. They must then systematically perform and document all relevant tests, including detailed pupillary examinations under various conditions, e.g., dim light, bright light, near target for accommodation. Any deviations from normal should be meticulously recorded, including the degree and nature of the abnormality. This objective data should then be correlated with other clinical findings. The technologist's role is to gather and present this comprehensive information to the ophthalmologist, who will then make the definitive diagnosis and treatment plan. This systematic, data-driven, and collaborative approach ensures patient safety and adherence to professional standards. Question 17. The evaluation methodology shows that a COMT is presented with a patient exhibiting a new, irregular, and rapidly growing eyelid lesion. Which of the following diagnostic and management steps best reflects the COMT role and responsibilities within the established regulatory framework for ophthalmic medical technology? Option A. Document the lesion's characteristics, size, shape, color, texture, presence of ulceration or bleeding. Note any associated symptoms, and immediately report these findings to the supervising ophthalmologist for further evaluation and management. Option B. Perform a biopsy of the lesion to obtain a tissue sample for pathological examination. Option C. Prescribe a topical antibiotic ointment to treat potential secondary infection of the lesion. Option D. Reassure the patient that most eyelid lesions are benign and advise them to monitor the lesion for changes over the next few months. The correct answer is B. Perform a biopsy of the lesion to obtain a tissue sample for pathological examination. Explanation. The evaluation methodology shows that a certified ophthalmic medical technologist, COMT, must possess a comprehensive understanding of eyelid pathology, including the differential diagnosis and appropriate initial management steps. This scenario is professionally challenging because eyelid lesions can range from benign to malignant, requiring accurate identification and timely referral for definitive diagnosis and treatment. The COMT role is critical in gathering the necessary clinical information to assist the ophthalmologist. The correct approach involves a systematic evaluation of the eyelid lesion, including its morphology, size, location, and associated symptoms, followed by documentation and communication of findings to the supervising ophthalmologist. This aligns with the COMT scope of practice as defined by professional guidelines and ethical responsibilities, which emphasize patient safety and accurate data collection to facilitate optimal patient care. The COMT is expected to recognize signs that warrant further investigation and to act as a patient advocate by ensuring appropriate follow-up. An incorrect approach would be to dismiss a suspicious lesion as benign without a thorough examination, or to attempt to manage a lesion beyond the COMT-defined scope of practice, such as prescribing medication or performing a biopsy. These actions would represent a failure to adhere to professional standards and could lead to delayed diagnosis of malignancy or inappropriate treatment, potentially harming the patient and violating ethical obligations to practice within one's competency. Another incorrect approach would be to fail to document findings or to communicate them effectively to the ophthalmologist, thereby hindering the diagnostic and treatment process. Professional reasoning in such situations requires a systematic approach. First, meticulously gather all relevant clinical data about the lesion. Second, compare these findings against known benign and malignant eyelid pathologies. Third, recognize the limitations of the COMT role and the necessity of ophthalmologist consultation for definitive diagnosis and management. And fourth, ensure clear and accurate communication of all findings. This structured decision-making process prioritizes patient well-being and upholds the professional integrity of the COMT. Question 18. The audit findings indicate a discrepancy between a patient's reported symptoms during a preliminary interview and the documented findings in their electronic health record from a previous visit. As a certified ophthalmic medical technologist, COMT, you are tasked with performing the initial diagnostic testing. What is the most ethically and professionally sound course of action? Option A. Immediately alter the previous record in the electronic health record to align with the patient's current reported symptoms before proceeding with testing. Option B. Discuss the discrepancy with other ophthalmic assistants and technicians to gather their opinions before approaching the physician. Option C. Proceed with the diagnostic testing based on the current patient interview, and then inform the supervising physician of the discrepancy between the current interview and the previous record. Option D. Proceed with the diagnostic testing as if the previous record was accurate, and make a note in the chart about the patient's current reported symptoms. The correct answer is C. Proceed with the diagnostic testing based on the current patient interview, and then inform the supervising physician of the discrepancy between the current interview and the previous record. Explanation. This scenario presents a professional challenge because it requires the certified ophthalmic medical technologist, COMT, to balance the immediate need for accurate patient care with the ethical obligation to maintain patient confidentiality and avoid misrepresentation of their professional scope. The audit findings highlight a potential breach of protocol that could impact patient trust and the integrity of the ophthalmic practice. Careful judgment is required to address the situation without compromising patient well-being or professional standards. The correct approach involves a direct and honest communication with the supervising physician regarding the observed discrepancy in the patient's chart. This upholds the principle of professional integrity and accountability. By immediately informing the physician, the COMT ensures that the patient receives accurate care based on a correctly documented examination. This aligns with the ethical guidelines for COMT, which emphasize the importance of accurate record keeping and open communication within the healthcare team. Furthermore, it respects the physician's ultimate responsibility for patient diagnosis and treatment, while demonstrating the technologist's commitment to patient safety and adherence to regulatory standards for documentation. An incorrect approach would be to ignore the discrepancy and proceed with the patient's examination as if the chart were accurate. This fails to address a potential error that could lead to misdiagnosis or inappropriate treatment, directly violating the COMT duty of care to the patient. It also represents a failure to uphold professional integrity and accountability by not reporting a significant observation. Another incorrect approach would be to alter the patient's chart to match the observed findings without consulting the supervising physician. This constitutes falsification of medical records, a serious ethical and regulatory violation. It undermines the integrity of the patient's medical history and can have severe consequences for patient care and legal repercussions for the technologist and the practice. A further incorrect approach would be to discuss the discrepancy with other staff members without first informing the supervising physician. While seeking advice might seem helpful, it bypasses the established chain of command and can lead to gossip or speculation, potentially violating patient confidentiality and creating an unprofessional environment. The primary responsibility for addressing such a discrepancy lies with the supervising physician, and the COMT role is to facilitate this by providing accurate information, The professional decision-making process in such situations should involve 1. Identifying the discrepancy and its potential impact on patient care. 2. Recalling the scope of practice and ethical obligations as a COMT. 3. Prioritizing patient safety and accurate documentation. 4. Communicating the observation promptly and professionally to the supervising physician. 5. Following the physician's guidance for resolution. Question 19. The risk matrix shows a patient reporting significant visual discomfort and distorted image formation, specifically describing lights as having starbursts and straight lines appearing wavy when viewed through their current corrective lenses. Given the COMT understanding of light refraction and image formation, which of the following actions best reflects the appropriate professional response? Option A. Advise the patient that such visual phenomena are inherent limitations of the human eye and cannot be corrected by optical means. Option B. Document the patient's subjective complaints and proceed with standard objective refraction testing to determine the underlying refractive error, noting any discrepancies between subjective reports and objective findings. Option C. Immediately adjust the patient's current lens prescription based on the subjective description, assuming the lenses are the sole cause of the perceived distortions. Option D. Dismiss the patient's description of starbursts and wavy lines as common subjective artifacts of vision and focus solely on measuring visual acuity. The correct answer is B. Document the patient's subjective complaints and proceed with standard objective refraction testing to determine the underlying refractive error, noting any discrepancies between subjective reports and objective findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified ophthalmic medical technologist, COMT, to interpret subjective patient responses regarding visual perception in the context of objective optical principles. The challenge lies in bridging the gap between the patient's reported experience of image formation, e.g., blur, distortion, and the underlying physical optics of light refraction. A COMT must not only understand the physics of how light forms an image, but also how deviations from ideal refraction, or optical aberrations, manifest subjectively, and how to accurately document these findings for the ophthalmologist. This requires careful observation, precise questioning, and accurate recording, all while adhering to professional standards of care. Correct approach analysis. The correct approach involves systematically assessing the patient's subjective visual experience in relation to objective optical findings. This includes asking specific questions about the clarity, shape, and location of perceived images, and correlating these subjective reports with objective measurements of refractive error and any observed optical aberrations. For instance, if a patient reports seeing halos around lights, the COMT should consider potential causes like corneal edema, lenticular changes, or specific refractive errors that might induce such phenomena. The COMT role is to gather comprehensive, accurate data that aids the ophthalmologist in diagnosis and treatment. This aligns with the COMT scope of practice, which emphasizes the accurate collection and documentation of patient data related to visual function and ocular health, as outlined in professional competency standards that implicitly require understanding the principles of light refraction and image formation to interpret findings. Incorrect approaches analysis. Dismissing the patient's subjective report as insignificant without further investigation is an ethical failure. The patient's perception of their vision is a critical piece of data. Ignoring it means failing to collect complete information, which could lead to a misdiagnosis or delayed treatment by the ophthalmologist. This violates the principle of patient-centered care and the COMT responsibility to be thorough. Focusing solely on objective refractive measurements without probing the patient's subjective experience of image quality is also a failure. While precise refractive data is essential, it does not capture the full picture of visual function. Aberrations or other optical issues not directly measured by standard refraction can significantly impact a patient's vision and quality of life. The COMT role is to bridge objective and subjective findings. Assuming the patient's description of image formation is due to a specific pathology without a systematic assessment is premature and unprofessional. While the COMT has knowledge of optics, they are not the diagnosing physician. Their role is to gather and present data, not to make definitive diagnoses. Jumping to conclusions without a structured approach can lead to biased data collection and miscommunication with the ophthalmologist. Professional reasoning. Professionals in this situation should employ a systematic approach. First, Actively listen to and acknowledge the patient's subjective description of their visual experience. Second, ask targeted questions to clarify the nature of the perceived image distortion, e.g., are the lights blurry? Do they have a halo? Is the image doubled? Third, perform objective tests to measure refractive error and assess for any optical aberrations, e.g., using a lensometer, autorefractor, or observing the patient's response to different lenses. Fourth, correlate the subjective reports with the objective findings, noting any discrepancies or consistencies. Finally, document all findings accurately and comprehensively for the ophthalmologist, highlighting any observations that might be relevant to the patient's reported visual disturbances. This methodical process ensures that all relevant data is collected and presented, enabling the ophthalmologist to make an informed diagnosis. Question 20. Research into the assessment of a patient presenting with chronic intermittent eyelid discomfort and a sensation of dryness reveals subtle irregularities along the eyelid margins. Which approach best aligns with the Certified Ophthalmic Medical Technologist, COMT, scope of practice and ethical responsibilities in evaluating the health of the meibomian, Zeiss, and Mall glands? Option A. Conduct a comprehensive slit lamp examination of the anterior segment, focusing on the cornea and conjunctiva, while briefly noting the general appearance of the eyelid margins. Option B. Perform a detailed examination of the eyelid margins, including visual inspection for signs of inflammation, obstruction, or altered secretions from the meibomian glands, and palpation for any abnormalities of the glands of Zeiss and Mall, correlating findings with patient symptoms. Option C. Immediately proceed with diagnostic imaging of the lacrimal system, assuming the eyelid symptoms are secondary to a more complex tear drainage issue. Option D. Rely primarily on the patient's subjective report of dryness and discomfort to formulate a preliminary assessment of ocular surface disease. The correct answer is A. Conduct a comprehensive slit lamp examination of the anterior segment, focusing on the cornea and conjunctiva, while briefly noting the general appearance of the eyelid margins. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the COMT to interpret subtle clinical signs related to eyelid anatomy and function, specifically the health of the meibomian, Zeiss, and Mall glands. Misinterpreting these signs could lead to an incorrect diagnosis or treatment plan, impacting patient comfort and ocular health. The challenge lies in differentiating between normal physiological variations and early signs of pathology, demanding a thorough understanding of the normal structure and function of these glands and their potential dysfunctions. Correct approach analysis. The correct approach involves a systematic assessment of the eyelid margins, including visual inspection for signs of inflammation, obstruction, or altered secretions from the meibomian glands, as well as palpation for any nodules or tenderness associated with the glands of Zeiss and Mall. This approach is justified by the COMT scope of practice, which mandates accurate data collection and preliminary assessment to support the ophthalmologist's diagnosis. Adhering to established clinical protocols for eyelid examination ensures that all relevant structures are evaluated, aligning with the ethical obligation to provide competent and thorough patient care as outlined by professional standards and guidelines for ophthalmic medical personnel. Incorrect approaches analysis. Focusing solely on the anterior segment without a specific examination of the eyelid margins and their associated glands represents a failure to conduct a comprehensive assessment. This approach is ethically flawed as it omits critical diagnostic information, potentially leading to a delayed or misdiagnosis of conditions affecting these glands. Over-reliance on patient symptom reporting without objective clinical findings is also professionally unacceptable. While symptoms are important, they must be corroborated by physical examination findings. Ignoring or minimizing the importance of the meibomian, Zeiss, and Mall glands in favor of more common ocular surface issues is a regulatory failure, as it deviates from the expected standard of care for a complete ophthalmic examination. Assuming a diagnosis based on a single, isolated finding without considering the broader context of eyelid anatomy and gland function is a significant diagnostic error and a breach of professional responsibility. Professional reasoning. Professionals should approach such situations by first recalling the fundamental principles of ophthalmic anatomy and physiology, specifically focusing on the eyelids and their adnexal glands. A systematic, head-to-toe approach to the eye, starting with the eyelids, is crucial. This involves a detailed visual inspection, palpation, and assessment of secretions. When faced with ambiguous findings, the professional should consult established diagnostic criteria and imaging techniques if available and indicated. Collaboration with the supervising ophthalmologist is paramount for complex cases or when diagnostic uncertainty exists. Maintaining meticulous documentation of all findings and the rationale for diagnostic impressions is also a critical component of professional practice.